Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat with the Islamic Medical Association. Alhamdulillah Rabbil Alameen, wa salatu wa salamu ala ashrafil mursaleen, Sayyidina wa Nabiyyina wa Mawlana Muhammad wa ala alihi wa sahbihi ajma'een. Today we've got a wonderful guest for you, but as usual we start with tarbiyah and some advices. And something we haven't spoken about in a long time, we have spoken about before, is the etiquette when visiting a sick person. And recently in my family I had somebody who was suffering from an illness, and we went to visit him. And it always reminds you that there's a specific way that a Muslim should behave when they visit the sick person. Rasulullah Sallallahu Alaihi Wasallam said we should visit the sick, feed the hungry, and free the one who is in prison. And there are many hadith in Bukhari, Muslim, and across the spectrum of reported traditions of Rasulullah Sallallahu Alaihi Wasallam encouraging us to visit the sick. Obviously, we need to make sure when we visit the sick person that our intention is correct. We don't go there, to ogle, find out what's wrong, make sure whether they left us some money in the will, what's going on. So those are the things that we need to just make sure we're doing. Our etiquette needs to be correct. So our intention needs to be clear. We're making khidmat of the person. We're going to see them, making sure they well, paying our respects to them, making sure that they understand that we care for them, and also comforting a fellow person. It's important also sometimes to make arrangements with the family. Don't just pitch up there on a day when it may be inconvenient. If someone's in a hospital, they may be undergoing some treatments and so forth. Stick to visiting hours, visiting times, and request and respect the wishes of the family and the ill person. Obviously, if the person is very ill, finding it difficult, it may not be suitable to visit them very frequently. You need to sometimes choose a suitable gift. Sometimes it's worthwhile going there. Don't take sweets for a diabetic. That's a common one. Use something that the person will appreciate, be able to use, and maybe will give him some comfort at that time. And then the length of the visit is important. You shouldn't go there and maybe spend the whole afternoon there, have some tea, stay for supper, watch a movie. Those type of things are not appropriate. It's important that when you do visit someone who's sick, your intention is clear, and then you make sure that you fulfill your intention and don't go beyond that. Don't go beyond that. And then what you say to the person is also important. There's an important sunnah of Rasulullah Sallallahu Alaihi Wasallam that you encourage the person. You leave them with a feeling of hopefulness. You don't go there and say, "Bye, you're looking very sick. I don't know how you survived so long. You're lucky to be alive." So those are the type of things which we really, as Muslims, need to think about when you do go and visit a sick person. I know, some hospitals, famously, when you go in there, it's like a party. You walk in and then there's 1,000 family members. They came to see each other. It's like a bit of an occasion to meet each other. That's not really the purpose. So make sure your intention is clear. Go there, fulfill your purpose, and go home. There is an element of building family ties and visiting a sick person together and so forth, but we need to be clear what our intention is. So, alhamdulillah, with that said, I'd like to welcome Dr. Bilal Bobat. Assalamu alaikum wa rahmatullahi wa barakatuh, Bilal, and welcome to Health Matters.
Shukran so much for inviting me. Wa alaikum assalam. Assalamu alaikum wa rahmatullahi wa barakatuh to the viewers tonight. Inshallah, we'll be discussing a few matters related to the liver this evening.
So Bilal is a hepatologist or a liver specialist and a gastroenterologist. So that's someone who deals with things in the gut and your intestinal system, your gastrointestinal system. And the liver is closely tied into the gastrointestinal system. And that's why hepatologists and gastroenterologists tend to overlap in their function. We are going to be discussing predominantly fatty liver with Bilal. Bilal is a specialist at Johannesburg Hospital and the Wits Gordon Medical Center. So, Bilal, you want to tell us a little bit about the liver?
So, the liver by mass is one of the largest organs in the body.
Okay.
It sits protected in what we call the right upper quadrant of the abdomen, just slightly behind the ribs.
Okay.
It is normal for it to extend slightly below, just a fraction below the ribs at times, where it's nice and protected, because it being such an important organ.
Right.
Not so much like the kidneys.
It's got lots of blood vessels and things like that. So obviously, if it gets injured, it can bleed a lot. So it needs to be protected quite nicely.
It needs to be protected.
Okay.
The liver, in terms of its function, are numerous. They say that if you were to manufacture a liver, it would be it would take up the size of a large chemical plant.
Sure.
Over many acres, because of the multiple processes occurring simultaneously
in the liver. So what does the liver actually do? What's the purpose?
So one of the big things that the liver does is that it detoxifies the body.
Right.
The gut, essentially, the bloodstream flows into the liver. And what happens is that you have all the bloodstream from the intestines and the spleen that form something called the portal vein.
So this comes from the gut. Whatever blood comes from the gut first goes to the liver.
First goes to the liver. Right?
And why is that important?
And that's important so that anything that's absorbed can be detoxified
Before it reaches the rest of your body.
before it reaches the rest of the body.
Okay.
And things which you see going wrong
Right.
when the liver starts failing, individuals start becoming very confused.
Yes.
They can become disorientated. You get a funny breath and a smell of ammonia
Right, right.
on their breath, which isn't altogether pleasant and shows the importance of the functions of the
Right.
liver.
So, I mean, the liver is like a purification plant for toxins. And obviously, most of your toxins are coming from the food that you're eating initially.
Correct.
And so that's why that bloodstream goes straight to the liver first for it to fix it up before it can go to the rest of your
Straight
body.
to the liver first.
Okay.
When it goes to the liver, what happens is that things are detoxified, nutrients are directed in certain fashions,
Right, right.
metabolized or changed. Their properties are changed. Either you're taking substances and converting them into fat for storage for
Right,
later
right,
on,
right.
or being packaged and sent to muscle in order to be utilized there.
Right.
But that's the detoxification element of the liver.
Yes.
In addition, the liver is an important
Synthetic.
synthetic
It's a plant,
organ.
yeah.
It's an organ which produces many hormones and chemicals.
Yes, yes.
One of the other things that you see when the liver starts failing is that a person bruises very easily.
Right, right.
This is now due to a lack of coagulation or clotting
factors. So the
which
liver makes those
produces.
clotting factors,
The li-
amongst other things.
Amongst other things.
Yes.
Additionally, certain hormones are produced
Okay.
in the liver. The liver can also be a site of red blood cell or
Okay.
production. It can control and send signals to other parts of the body to say, you know what, we need more of this substance. For
Yes,
instance,
it's a very versatile organ. It can
very versatile.
and it can change its function and grow and shrink depending on what it needs to do at times as well.
That's true. That's true.
Okay. Now, I mean, after the blood goes to the liver, then obviously it drains into the rest of the circulation. The heart pumps it out to the rest of the body, and it's now the nutrients have been packaged or changed to what's a usable form for the person to use. So obviously it explains why the liver is susceptible to things that you take in through your to damage from things that you may take in.
Absolutely. The liver it can be insulted somewhat. Although it is still a hardy organ, it can be insulted by a variety of means.
Right,
One
right.
of the most common is alcohol.
Right.
As soon as alcohol is absorbed, it travels directly
It first
to the
goes
liver,
to the liver, yeah.
where it is metabolized
Right.
into products that the body can then deal with.
Because if it goes straight to your brain, for example, it will make you drunk with just very little alcohol.
Very little, and that can be very dangerous.
Yes,
and that's
absolutely.
why you need to drink a certain amount before drunkenness.
Because it overwhelms what the liver can do.
That's correct.
Okay. And then obviously, if you continue drinking, that process damages the liver mostly because it goes to the liver initially. And then it obviously can damage other organs as well.
That's it. So what happens in the liver is that when it's changing these molecules,
Yes.
what happens is that you have a system whereby the liver metabolizes or converts problematic chemicals into
Right.
safer chemicals.
Right, right.
But that is a very energy intensive process. And what can happen when that capacity is overwhelmed is that it can start converting those chemicals
Into toxic things.
into potentially toxic things, and we call these oxidative species.
Right, yes.
Right? And
They overwhelm
oxidants
the liver's protective function. Yes.
And oxidants in turn result in inflammation within the
Okay.
liver. And the body's own immune system can start attacking the liver in its own right.
Okay.
And this is one of the ways that alcoholic hepatitis
Damages the liver over
can
time.
damage the liver over time.
Okay, I mean, we're going to concentrate today particularly on fatty liver disease, which is a relatively insidious condition which people don't really recognize. It's often found coincidentally, but it has the potential to progress towards quite severe damaging liver disease. What's the end stage of liver disease, Bilal?
The end stage of liver disease is chronic liver disease, cirrhosis of the liver. This is manifested by essentially a failure of the synthetic function.
So the liver can't make things, yeah?
So the liver can't make things that it normally makes.
Yes.
And as a result, these individuals bruise easily, as I've said. They often have more features of estrogen.
Right.
So men start losing hair.
They get breasts and so forth.
They get breasts and very red hands, other features of...
And that's because the liver would normally metabolize that estrogen.
Metabolize that estrogen away from its active component.
Yeah.
Then you have a syndrome called portal hypertension.
Right.
As I said, the portal vein is a vein that drains the gut and the spleen before it enters the liver. The liver is essentially what we call a portal system.
Yes.
So if you were to imagine that this is the portal vein, it breaks up into multiple small vessels in order to wash the liver cells.
Yes.
It then reforms
into a big vein and then goes to the heart.
Small veins, medium veins, big veins, and back into the heart.
So it's, I mean, the blood that goes through the gut goes through two sets of capillaries before it comes back to the heart.
Correct.
So it goes through the capillaries in the gut, reabsorbs all the foods, and then goes through the portal vein to the liver, and then through the liver system, and then back to the heart. Maybe we can just show the first slide. I think that shows some of the spectrum of fatty liver and the prevalence of it. So, or maybe the next one we can bring up. Okay. Look, I think go on further, and I'll tell you where to stop. This is a good one. Okay.
This is then a slide showing. In fact, no. One more, please. Just move on to the next slide.
Right.
So this shows the stages of liver damage, and this is particularly true for alcoholic, and then something that I think is very relevant to our community, non-alcoholic fatty liver disease. So you get a healthy liver, you get fat deposition. That fat deposition can, in 10 to 35% of individuals, can result then in inflammation within the liver. The protective capacity of the liver is overwhelmed, you have oxidation, and you have the immune system driving inflammation within the liver.
You develop a hepatitis.
A hepatitis.
Right.
Hepatitis heals with scarring.
Okay.
And that scarring results in what we call cirrhosis.
Okay.
Cirrhosis is this nodular, bumpy liver, as opposed to that smooth, nicely formed liver. This is a very misshapen liver, scarred.
Because of scarring and regeneration and cycles of scarring and regeneration.
Correct. Now, when that happens, when you have cirrhosis, as you can see, think of the liver like a sponge.
Yeah.
Right? And a normal sponge would just allow water to pass through nicely. Now, if you were to take a sponge and dip it into paint, which then dries, that's the equivalent here of cirrhosis.
The liver becomes hard and
poorly absorbent. Now, if you take a hose pipe and spray water,
it doesn't do the job. Yeah.
It doesn't pass through. It tries to find different ways of passing through. And as a result, what happens is that you have the body thinking there's a problem in the liver. We need to absorb more water. Right? And then with it absorbing more water, the vessels also try and adapt to try and increase blood flow through the liver in order to have that normal physiologic response.
Yes, to try and compensate for what you've lost. Yes.
To try and compensate. And what then happens is that you have, with that holding on to salt and water, you have an accumulation of what we call ascites.
So fluid.
Ascites is fluid in the abdominal cavity, and this can be very severe. Individuals can look 9 months pregnant.
Yeah, and that's really one of the key, most severe symptoms of severe portal hypertension and liver failure.
Correct.
So we're going to go for a short break now, but when we get back, inshallah, we're going to be discussing some of the key causes of this condition and then what can be done about it, as well as answering some of your calls. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to Health Matters. We've been discussing liver disease and we're going to concentrate on fatty liver disease. We've been talking to Dr. Bilal Bobat, hepatologist. Bilal, we touched on some of the spectrum of pathology of liver disease, but maybe let's take a step back and just discuss, before we go into what actually causes it, just discuss liver disease in general. How common and where does fatty liver fit into it? Maybe we can put a slide up. We've got a slide which sort of gives you an idea of the spectrum of liver disease in South Africa. Can you just talk us through this, Bilal?
Okay, so this is a 10-year audit data from the Wits Donald Gordon Medical Center Liver Transplant Unit,
right,
just showing conditions that we transplant for.
Right.
Firstly, you can see non-alcoholic steatohepatitis.
That's the first one.
That's
NASH.
the first one, NASH, and then followed by alcoholic steatohepatitis.
Right.
If you combine both of those, you get up to 71, which then puts it as the second most common cause of transplantation.
Yes.
Now, those can be considered as diseases of lifestyle.
Right.
This is what people have either eaten themselves into liver disease or drunk themselves.
Yeah, so I mean, alcoholic
liver
liver disease is really, if you drink alcohol, you develop alcoholic liver disease. The alcohol
significant amount of alcohol
destroys the liver,
That's good.
pickles the liver, and that's it.
Yeah.
And obviously, the amount of alcohol is important, but we're not going to concentrate on that.
No.
Obviously, it doesn't mean it doesn't exist in our community. It exists through all communities, but it's, we're going to concentrate on NASH, which is a relatively unrecognized cause of liver disease. Many people don't really know about it.
No. And you'll notice the similarity between the two terms. One essentially ASH and the other just has non-alcoholic steatohepatitis. Right?
Just before we get into it, just going further down there, you can see that infections also are an important cause. But I think infections as a cause of cirrhosis has gradually been declining in South Africa, especially with vaccinations for hepatitis B and so forth.
Alhamdulillah, vaccinations have resulted in a massive change. Specifically hepatitis B. South Africa is a high hepatitis B prevalence region, and with the introduction of the hepatitis B vaccine, which occurred in the mid-90s,
it became compulsory for all children.
For all children. The incidence of hepatitis B related liver disease has dramatically reduced, but is not gone.
Yes.
We still see hepatitis B to this day, especially in individuals that were born before 1995, when this
or those who are not vaccinated, which for some reason, various reasons, does happen from time to time.
Does happen, most certainly. Hepatitis A is then another cause of liver disease, especially in pregnant women and young children.
Yes.
Right? They can quickly develop what we call a fulminant hepatitis.
So it comes on and destroys the liver in one go.
In a week. They can go from normal to complete liver failure.
Yes.
And that's an absolute emergency.
But it's relatively rare, thankfully.
Alhamdulillah, at least that is very rare.
Okay.
And because we're a referral unit for the country,
we see those cases.
We still see those cases.
Yes.
Other causes of liver disease, a big cause would include autoimmune causes, and I'd include that large, tall building there called biliary disorders. Biliary disorders are where there's a problem with the bile ducts leading from the liver, which creates bile. Into the gallbladder and the ducts beyond.
Yes.
Right?
And I mean, the numbers there are large, but I would suspect that the majority of those cases were actually congenital biliary abnormalities?
You have a large number of congenital,
Yeah.
so biliary atresia in children. In adults, it's autoimmune conditions, primary sclerosing cholangitis, primary biliary cholangitis are two of the most common. Straightforward autoimmune hepatitis, where the body, for no apparent reason, starts attacking the liver, is another.
But it's one of the
cause.
part of the spectrum of autoimmune conditions which affects many different organs.
Correct.
So the liver can be a target for your immune system as well.
Correct.
If things don't go right. So let's go back to non-alcoholic liver disease. But I do want to remind you that we welcome your calls. We'll put the number up on the screen, and we welcome you to give us a call with your questions related to liver disease, and Dr. Bobat will be pleased to answer them. The number is 011-086-7777, and you can call us now. Bilal, let's talk about the cause, the pathophysiology. What makes people so you're not drinking alcohol, but you mentioned that it may be what you're eating.
Right. So what's happened in the last few decades, I'd say, is that modern society has moved from a situation where we used to eat far cleaner. A lot of people back in the olden days used to even grow their own vegetables in their garden.
Yes.
The bread was often made at home.
Yes.
Not necessarily a shop bought processed loaf.
Yes.
What has happened since probably the 1960s is a commercialization and an industrialization of our food industry. That has resulted in shortcuts being taken in the manufacture of food and high energy food sources being integrated into our diet.
Sure.
One of the biggest culprits is fructose.
Yeah, sugar.
And one of the sugar molecules,
Yes.
And this has resulted, the body doesn't really process fructose as well as it processes
Glucose.
other sugar molecules such as glucose.
Yes.
So what happens here is that we are now living in an age of an energy surfeit. We work generally at desks. We're no longer working out in the fields. We no longer have physical labor like we used to. Our transportation is a lot more convenient. We sit in a vehicle.
So we don't walk to work. We
don't
just jump into our car and
jump into the car, even if it's 2 kilometers away, for sake of convenience.
So this energy just builds up in our body.
So we live in an age of an energy surfeit.
Okay, I'm going to interrupt you for a second. We have a caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum, Dr. Shoaib. How are you?
Alhamdulillah, I'm well. How are you, brother?
And salam to Dr. Bilal. It's a wonderful program. What I want to know, I'm 80 years old.
Right.
And many years back, I had what you call excessive vomiting. And they told me that my entire digestive system was full of fat. Right? And as a result of which I have been diagnosed with lactose intolerance.
Okay.
Now, what is lactose intolerance in relationship to this fatty liver? Because what happened is, because of that, I have to keep away from dairy products, and enemy number one is things like cheese. I cannot even eat pure milk, ice cream, and things like that. Can you just comment on that, please?
Okay, Bilal, you want to just let us know?
Thank you.
Okay.
So lactose intolerance is a very common condition. Humans are one of the few mammals that continue to drink milk into adulthood. Most other species lose the ability to drink milk. And with men or mankind,
humanity, we continue drinking milk.
We continue drinking milk, but some of us...
But not from our mothers.
No. Some of us lose the enzyme called lactase. Lactase is what breaks down the sugar in milk. If that sugar is not broken down, yes, it'll cause vomiting, diarrhea, severe bloating, and generally feeling unwell. Fat throughout the gastrointestinal system, I'm not too certain where that would fit in with lactose intolerance.
But maybe he had a fatty liver, which could have been coincidental. I don't know if it would be directly related.
And that's something that I was going to suggest. I don't think the two are necessarily related. Lactose intolerance occurs commonly as you get older to varying degrees. Some people will notice that if they drink a milkshake or have a large glass of milk, they may have a loose stool.
Yes.
And not necessarily the full-blown symptoms of vomiting, bloating as severe as...
And it may be vary to degrees. So some people may be completely lactose intolerant. That means even a small amount of milk may give them significant symptoms. And others may be able to tolerate some milk without huge amounts of milk. And you mentioned maybe cheese is worse for you than other things. So I mean, that's one. Yogurt, can you have yogurt if you lactose intolerant?
Yogurt already
the lactose is broken down. Yeah, so
that's
the advantage. And you can get some of your benefits of the proteins from dairy through yogurt rather than getting it straight from milk.
Correct.
Or sour milk may also be a way where the lactose is partly broken down already by bacteria.
And there are also supposed lactose-free milks.
Yes.
But that's essentially
usually soya and other things like that. Soya milk. Okay, so let's get back to where we were. So we were talking about the causes of liver disease. So you mentioned that, we have this high fructose intake, and I mean, sucrose is basically a disaccharide. Sugar is a disaccharide. That means it's made out of two sugars, and the one is glucose and the other one is fructose. So the two of them together make the sucrose molecule. So if you have a large amount of sugar, you are actually taking quite a lot of fructose in.
Correct. And you know what, this industrialization of our food consumption has resulted is far more sucrose and fructose being included in our diet.
Yes, I think particularly high fructose corn syrup,
is a particular culprit that you'll find in many industrialized foods. So processed cakes, that you'd buy from a store. Processed cakes, you'd find it in soft drinks. Sweets. An absolute myriad of products have high fructose corn syrup, and it's potentially it results in a syndrome called insulin resistance.
Right.
Now, what happens is that when the body takes in an energy load, right, the liver looks at this energy package coming in and says, okay, between meals, I have been utilizing my stores.
That are stored in the liver mostly.
Stored in the liver. So when you fast, for instance, you deplete your liver stores of energy, and that's stored in a molecule called glycogen.
Right, which is like a polymer of glucose, multiple glucose molecules all in a chain.
Bound together.
And then you break it off as you need it.
As it's needed. And the other important place that glycogen is stored is the muscle.
Right.
So as you exercise, you're also burning off the stored sugar. But as I mentioned, we're sitting in an age of high energy consumption, low energy utilization.
So I'm going to interrupt you again. We're getting a few more callers now. Assalamu alaikum wa rahmatullahi wa barakatuh.
Maalaikum assalam, Dr. Wadi.
How are you, brother?
Fine, Dr. Babad.
Assalamu alaikum.
Maalaikum assalam. Dr. What I want to ask you is that we have hepatitis A, B, C, which is the one that is the most fatal one. And then the other question I want to ask you is about the effects of statins on the liver.
Okay.
And also, sorry, one was the liver injuries. Can liver heal on its own?
You mean with like a physical injury?
Yes, or an accident or whatever, yes, physical injury.
Okay, maybe we can quickly go through those.
Okay, so hepatitis A is generally a relatively mild form of hepatitis. Often children don't even realize that they've had it.
They feel like it's like a flu-like thing and it goes away.
Flu-like illness, they may have a bit of a runny stool, they feel down, they have lack of energy for a period of time, but kids, nothing really stops them and they're up and running very shortly.
I mean, there's some people who say that the majority of South Africans who are living in rural areas and in poor areas have probably had hepatitis A and are immune to it.
Correct. And I wouldn't even just restrict it to rural areas. I'm sure a lot of urbanites as well have been exposed to hepatitis A. In adulthood, it can be a little bit more severe. You'd see the actual physical jaundice and lethargy, what we call malaise, right, which will last for anywhere between 6 to 12 weeks. Hepatitis B occurs in two forms, and it depends on at what age you contract the hepatitis B. If you contract the hepatitis B as a child, or what we call a neonate, a newly born infant, this is commonly when the mother transmits it to the infant in the birthing process. This will often not result in any clinical signs at that time, but later on in life, in the 20s and 30s, they can start showing signs of liver damage, and some of these individuals just present with liver cancer, which is one of our dreaded complications, because there isn't much we can do to treat liver cancer other than remove the cancer, and that's only possible if the remaining liver tissue is
there's enough of it.
Is enough and not damaged.
It's healthy, yeah.
And is healthy. So that's the one stage, and a study done at WITS showed that the average age of patients with hepatocellular cancer or liver cancer was in their mid-30s, which is very young.
And that's often in patients with, as you say, congenital hepatitis B infection.
Correct.
And there are areas of the country, as you mentioned earlier, which are endemic, where hepatitis B really pervades throughout the community. It's quite strong. Yeah.
Hepatitis B now is spread in similar mechanisms to HIV. So through sexual contact, blood transfusions, and mother to child. However, it's 100 times more infectious.
Yeah.
So as a result, one of the other mechanisms that it's spread by is some cultures have
saliva, and
where an elder will chew some food for a child and then put it into the child's mouth.
Yes, yes.
Now, if this elder has dentures...
So we do that, obviously, the culture of chewing a date and putting it into a young child's mouth. So if there is a high prevalence of hepatitis B, it can be spread in that way.
It can potentially be spread in that way. If you contract hepatitis B as an adult, it's often a far more severe illness. You often have fever, you're physically jaundiced, and jaundice, I mean the yellowness of the eyes. And again, the hepatitis B can result in liver failure,
right,
which may necessitate a liver transplant, or in the vast majority of cases, as an adult where you have a fully functional immune system, the body is able to recognize the hepatitis B as an infection and get rid of it.
Okay.
All right.
Hepatitis C.
Hepatitis C now is another one which is a bit more
often chronic.
Often chronic.
Yes.
You don't realize that you've contracted it. And ways of contracting hepatitis C are through blood transfusions. Hepatitis C was only identified in 1992. So prior to that, we didn't know
that it existed.
Individuals that received blood transfusions before 1992.
It used to be called non-A, non-B hepatitis.
Correct.
They knew something is damaging the liver, but they didn't know what it was
until 1992.
But it turns out to be pretty common.
Yes. And the hepatitis C management has recently been completely revolutionized. In the past, it was very difficult to treat hepatitis C. Alhamdulillah, in 2012, a new drug was launched, which results in 95% plus cure rates.
That's much more effective.
And the second generation of these drugs are now coming out, which result in even higher, close to 100% cure rates for hepatitis C.
Okay, we're going to go to our air break now. And then inshallah, when we come back, maybe if we can remember the other two questions, we'll try and get to them, and then we get back to our topic. Assalamu alaikum wa rahmatullahi wa barakatuh, and we're back with discussion of liver disease and particularly fatty liver disease. We did have some outstanding questions which we need to answer, but brother, we'll try and get to them at the end, inshallah, because we're running out of time. Bilal, we were talking about insulin resistance and in its relation to fatty disease. So you have this excess energy. How does insulin resistance die in there? What happens with the insulin?
So what happens is that the liver, once it has filled up its storage space,
yes, of glucose, yes,
now starts sending these molecules of packaged glucose out, and it goes with a molecule of insulin,
right,
which goes to the muscle, and the insulin is a key which opens the door into the muscle and puts the excess.
So the sugar needs the insulin to get into the
cell
right,
and into the muscle cell,
right,
all right, and that's where the excess sugar is stored. But in time, if you're still eating too much and not exercising,
yes,
you run out of space to put this.
Right.
So what happens is that the insulin and the glucose goes back to the liver and says, we don't know where to go.
The liver takes it up again.
Takes it up and turns it into fat.
And then doesn't have anywhere to send the fat.
And then doesn't have any, well, it tries to put it into the fat cells, and often those fat cells are full.
Right.
And so it gets sent back again, and then that fat starts getting deposited within the liver.
So that's what we call fatty liver.
So that is now fatty liver.
Right.
Now, if I go back to my analogy of the liver being like a factory, if you consider a factory with multiple return orders,
the boxes are stacking up everywhere.
The boxes are starting to stack up on the production line, and space is running out in the factory. People are tripping over things. That's that oxidative stress.
Yes.
Right? And that stress results in injury. Someone in a factory with too many boxes around will fall, will drop things. Things get broken.
Yes.
Similar thing happens in the liver.
But injury can attract inflammation.
And that's that inflammation. All right.
Okay.
So you get the oxidative stress, which then attracts inflammation cells.
So inflammation cells are cells which usually we should be fighting infection and damage in your body, but because your liver is getting damaged by the fat, it's like the cops coming in.
Correct.
You know, and then the criminals coming in with them.
That's it, right? And what happens is that the liver starts getting damaged and destroyed
by the inflammation.
Yes. All right. Now, insulin resistance is part of a syndrome that we call the metabolic syndrome. The metabolic syndrome. Now, think of yourself. You need 3 of 5.
I'm going to interrupt you again, Bilal. I'm sorry, man. We're getting a lot of callers. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. How are you, my brother?
Alhamdulillah. We have quite a few callers, so if you can give us a question as short as possible, brother.
Okay. My name is Kesem. What I want to find out is I had a problem with a nerve running from the brain. I had a stroke, so that affected the nerve running to the eye.
Right.
All right. I've been to the doctor and they've given me medication, but I see that now, after all the treatment, I still get up and feel giddy, feel as if I'm going to fall down.
Okay.
What could be the cause?
Look, if you've had a stroke, there are lots of different reasons. We are discussing liver diseases today, Brother Qasim. So I'm just going to try and give you a short answer, as short as possible. But if you've had a stroke, there are many different reasons why you may be feeling giddy. Sometimes it has to do with vision. Sometimes it has to do with the ability of your body to sense the position it's in, especially if one side of your body's sensation is damaged. Or certain types of stroke affect certain parts of your brain which have to do with balance. So if you're still having symptoms, my advice to you, Brother Qasim, would be go back to your neurologist, let him do a detailed examination. Sometimes the medication actually makes the giddiness worse. And there could be other reasons. If you have high blood pressure or low blood pressure, then often you do feel giddy, especially when you stand up. So that's actually a very common symptom which has a lot of different potential causes. And you need someone to sit down with you and go through it in detail and try and get to the bottom of it. I hope that helps. Okay. Jazakallah. Okay. We have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh. Okay, we've lost that caller. Okay, so Bilal, let's get back to insulin resistance. We were talking about the metabolic syndrome. Yeah.
Okay, so what the metabolic syndrome is then is a syndrome of insulin resistance.
Right.
Now, in the syndrome,
so you've got insulin, but your cells are resistant to it.
So essentially, the key is rusty in the lock.
Okay.
Right, and it's not opening as it should. So what the body does
It
in
makes
order
more
to
and more keys.
more and more keys to try and get one to open up
Right.
those locks. All right,
Okay.
and in order to keep your sugar at a normal.
And the reason your
level.
cells become insulin resistant is they don't want to open the door. They're
They don't
full
want to.
already.
They're full already.
They don't want to allow the glucose to come in.
That's
They're full
it.
already.
That's it.
And then
All
that insulin obviously has secondary effects on its
Correct.
own.
Correct.
Besides just opening the cells, it does other things.
Such as growth factors, and
Right.
you can, it has been implicated in certain malignancies.
Yes, because it's a growth
formation.
factor.
It's a growth factor. Individuals with insulin resistance can get a black velvety appearance either under the arm or on the neck. It's something called acanthosis nigricans.
Right.
And these are some of the other effects of insulin.
And obviously, insulin resistance is a precursor to diabetes.
Correct. If that insulin resistance carries on, so what the body does is that it produces more and more insulin to try and keep your sugar at a normal level. But at a certain point, that insulin doesn't work and the sugar starts rising.
Right.
And that is when once it goes.
And that's how we
greater
define
than-
diabetes.
That's it.
But I mean, some people believe that severe insulin resistance and diabetes are just the same condition.
A continuum.
On a different spectrum.
Correct.
And the problem already starts when you have insulin resistance.
Correct. So let me just define then the metabolic syndrome.
Right.
You need 3 out of 5 criteria. The first is a waist circumference. In men, it's greater than 102 centimeters or 40
Okay.
inches. In women, it's 88 centimeters or 35
That's
inches.
quite a big difference.
It's-
So women are right to worry about their figures.
Yeah. Well, we all need to worry about
Okay.
our figures.
All right. Okay.
So that's weight, blood pressure.
So you may waist circumference, then blood
Waist
pressure.
circumference.
Yeah.
Blood pressure, anything greater than 130 over 85,
Okay.
which doesn't count necessarily as hypertension.
It should be high
but it's
normal.
elevated.
Right.
And then a fasting glucose of greater than 5.6
Okay.
millimoles per liter.
Which usually we would call impaired fasting glucose.
Impaired fasting glucose.
Okay.
And then on your cholesterol profile, your triglycerides of greater than 1.7 millimoles, so
Okay.
elevated triglycerides, and then something called HDL, or your good cholesterol,
Which is
being low.
Right.
All right.
So you just need 3 out of
you
those
need
5.
3 out of those 5, right?
Okay.
And you know, if you're sitting at home, check your waist,
Yeah.
check your blood, or go to the pharmacy, check.
But why would you want to make this definition? It sounds arbitrary. Okay, I've got 3 out of these 5, so I'm now metabolic syndrome. What does it mean for me?
So it puts you at risk for various other conditions. And we have a slide that shows what the metabolic syndrome and insulin resistance
To the liver.
does to, besides the liver, the heart.
Okay.
And
Maybe we can put that slide up. I think it was the second one that you showed there
That's it.
earlier.
And what happens is that it worsens your sugar control.
This is the one, yeah.
It increases inflammation. That inflammatory war that's occurring in the liver results in worsening of all of these. It worsens your sugar control. It worsens your high blood pressure. It worsens your your cholesterol, and that then all result in worsening cardiovascular outcomes.
So you're at higher risk of heart attacks and
attacks.
heart failure.
Correct. Right,
Okay.
and even possibly stroke. So it's cardiovascular disease, not just
Not just the
the
heart.
heart.
Yeah, the
right?
vessels as well, yeah.
So all the complications of diabetes, all the complications of hypertension can result in, or can be worsened rather, by the metabolic syndrome and having too much fat in the liver.
So would you say fatty liver is a manifestation of the metabolic syndrome, or is it the cause of the metabolic syndrome,
So
or is it a bit of both?
it's a bit of both.
Okay.
It is caused by the metabolic syndrome, but in turn, it forms a wheel.
Yes.
and propels that metabolic syndrome further, which then makes the fat in the liver worse, which makes the metabolic syndrome worse.
Now, I mean, I think there's an interesting thing that comes to mind for me. Can you be thin and have a fatty liver?
Yes, you can. So, you know, if you look at approximately 7% of individuals with non-alcoholic fatty liver disease have normal body mass indexes, right? So your body mass index is something that we use to define whether you are obese or not, all right? And the cutoff for obese is greater than 30, overweight is more than 25,
right?
All right? And this can be calculated by taking your weight divided by your height in meters, so
And
1 point,
squaring your height,
and squaring your height. So divide by your height twice,
Right,
essentially, right? And then you get your BMI. Now, lean individuals can have insulin resistance. So these are now individuals that may be taking in a lot of energy,
Right.
probably not storing it away as fat and able to be burnt off, but they're not necessarily active. So they've generally got low muscle mass as well.
So the muscles don't have a lot of capacity to
Don't
take
have a lot
up.
of capacity to take
And
up.
are there any genetic reasons why which would worsen it? Is it if your father was at risk of it, could you be at risk of it?
Absolutely. So they have discovered a few genes that have resulted in non-alcoholic fatty liver disease.
And it may depend on what set of enzymes you have in your liver that you're born with, and the
Correct.
capacity.
And how it reacts to that oxidative stress. And energy. And you know, my concern is, and this is an unfounded concern, it is a source of a potential research project going forward, is that our South African Indian population, because we have such a high incidence of diabetes,
Yes.
insulin resistance, I'm suspecting that we should have a high incidence of not just the simple fat in the liver, but the fat with the inflammation.
Okay.
And if you look at the progression here,
Okay. Okay, we're going to go to our last ad break because we're running out of time. But when we get back, we're going to wrap up and maybe just talk about what you can do to prevent and possibly treat fatty liver. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back. So we've been talking about fatty liver, Bilal. We went through some of the pathophysiology, its relationship to metabolic syndrome. And obviously metabolic syndrome is driven by having these high energy foods, lots of sugar, lots of carbohydrates particularly. Would fat in your diet lead to fatty liver?
So they've looked at that, and it seems to be more carbohydrate driven.
Sure, yeah.
Right?
It's at high fructose content.
That high fructose, very processed foods, which deliver a rapid, quick shot of energy into the bloodstream.
And your liver's got to deal with it chop.
Deal with it
and
chop,
that
chop.
makes a mistake.
And this puts that extra strain and stress on the liver.
So how can you prevent it?
So, you know, alhamdulillah, we've got the best example in the Prophet ﷺ. And one of the hadith in terms of diet was 1/3 food, 1/3 liquid, 1/3 air.
Right.
So essentially avoid overconsumption.
So moderation, give your body time to deal
Give your body
with your
time.
diet.
And then again, you know, I really feel getting back to basics.
Yeah.
Eat simple food.
Okay.
Try and you know, avoid things with high energy, high processed foods.
Right.
Try and if you're going to have bread, try and maybe look at making your own bread at home, which may be healthier.
Or more, less processed.
Less processed, more grains in your diet.
So we're running out of time. So the last point, just to take across, many men or women are diagnosed this coincidentally, you know, so they go for a scan or a sonar, so they do a liver function test and they find it. I mean, if they're lucky. If they're unlucky, they only discover it when the liver is quite severely damaged. Correct. But if you find it in the early stages, what say if you did a sonar and you found it in your own liver, what would it tell you?
So this is why I stress the metabolic syndrome. If you have features of the metabolic syndrome, you should be screened for fatty liver disease. And this can be done by a simple sonar that either your general practitioner or a radiographer, radiologist can do.
Right.
And they can detect fat on the liver with a simple ultrasound, which shows up as being very bright. At that point, your doctor should then look
check
at
your function of
liver functions, and there are various tests that are out there which can assess how much fibrosis there is in your
So
liver.
whether this is going to be a serious problem for you in terms of cirrhosis, or it's just going to be fat in the liver, but it's going to be linked to the metabolic syndrome.
Fat in the liver, which you need to deal with, and we'll get to that in a second.
So, Mahmoud, I'm sorry, Bilal. We're out of time, but I mean, I think this has really been an engaging show. We haven't even really touched on the topic because we had so many calls, and I'm sorry to interrupt you, but if you can give me one message in say 20 seconds.
If you have the metabolic syndrome, you need to have at least a 7% weight reduction, exercise, and cut out processed foods.
Right. That's it. That's a good message. If you have the metabolic syndrome, look for fat in your liver and do the things Bilal says. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.